Another study done by Dr. Yao looked at the effect of contractions and the effect of the oxytoxin, oxytoxic methyl ergonovine. And you can see here that over the top, let me use this so both groups can see it. Here we have blood volume, and you can see over the x-axis is time, and you can see over the 3 minutes that the babies gradually increase the amount of blood volume that they receive. Here in this one, what she did was to give an IV medication. This methyl ergonovine is a very strong oxytoxic that we don't use anymore, and it's given IV, and what that did was to cause the blood volume to all get to the baby in about 1 minute. The important thing to note is that here we're still just a little over 90, here we're still just a little over 90. So there isn't this whole huge reservoir of extra blood that's going to go over to the baby if we cause a contraction. And so that shows that it's not a problem to use the oxytocin or whatever else. This slide looks at gravity, and I told you that raising the baby up slows the transfusion, and lowering the baby speeds it. If this is a little bit different, this slide, because what it's actually showing you is the blood left in the placenta, not the blood in the baby. So if you, here on the left, we have the level that the infant's held. Remember, 10 centimeters is 4 inches. And if you look at the pink line, you can see that if the baby his cord is cut in 5 seconds, we're looking at about 130 mils or so that's left in the placenta with immediate cord clamping. And this is with the baby just at the level of the perineum. If you look at the yellow line, that's 30 seconds. And so you can see the baby gets a little bit more at the level of the perineum. It's about, leaves about 90 mils, so he's got a little bit more in his body. And then at 3 minutes, the baby has most of his transfusion. However, if you look down here at the yellow line at minus 40, you can see that in 30 seconds the baby's gotten most of the transfusion when you lower the baby way down. That's important to think about, because if you remember 10, 15 years ago, most obstetricians and midwives delivered the mother in stirrups, and they sat down, and the baby was brought down to their lap and dried and stimulated and suctioned before the cord was cut. So probably most of the people delivering before that time got most of their placental transfusion. But now we're putting babies up on the abdomen, and so that, I'll talk more about that in a minute. Here you can see that if you raise the baby way up over the C-section screen and held the baby there for 3 minutes, which nobody does, actually none of the blood would get to the baby. And these two, raising the baby 20 centimeters slows it down a bit, raising 40 the baby gets less blood as well. So we were very concerned about the effect of putting the baby skin to skin. We love it because we think it's very good for the baby. We know it's good for the mother. I could do 4 or 5 slides on the advantages that people see, but we were concerned about what happened when you put the baby up on the mother and then cut the cord right away. So we did a small pilot study involving 32 women, approximately 8 in each group, and we randomized them to 4 different groups. The first one here that you see in blue is immediate cord clamping. The second one was delayed cord clamping of 2 minutes. The one in green is delayed cord clamping of 5 minutes. And then the CM stands for cord milking. So what we found, as you can see here, obviously, that if we cut the cord right away with the baby on the abdomen, we got about 35 milliliters per kilo of blood when we drained the blood left in the placenta and measured it. And that was not significantly different from what we found at 2 minutes. However, when we waited 5 minutes, we waited 2 minutes, we got about 25 milliliters. And when we waited 5 minutes, however, there was only about 11 milliliters, average of 11 milliliters left. And with cord milking, we got about 18. So both the delay of 5 minutes and cord milking were significantly different than immediate cord clamping, and we felt that a delay of 2 minutes still leaves about 75 mils on average in the placenta, and so for our current term study, we decided to adopt the 5-minute delay with all the babies being placed skin to skin.